Okay, it is test, test, test. Okay, we are recording. Okay, here's your board. Can you hold that back? Yeah, if you can hold that for a second.
Sure.
Okay, this is Dr. Mays. It is September 9th. This is take one, and we're talking about CERT today. Okay? If you can hand it back.
19th.
19th. I'm sorry, it's the 19th. I'm ahead of myself. Okay. Dr. May, how are dental implants beneficial to the patient?
Well, I can think of quite a few reasons. Number one, if a patient's wearing a denture because they're missing all of their teeth and having trouble with that denture, it can be difficult to hold the denture in. So the implants can be placed so that the denture basically snaps into the implants, and can even make it difficult to remove sometimes, the denture. So it really, really helps the patient be able to chew, and function, smile, everything with the denture. If a patient's missing one or two teeth, there's different ways to replace, the missing tooth. If you do a bridge where you have to, basically drill on, remove tooth structure from either side, then you have more potential for decay and problems with that bridge later. It has less of a success rate than an implant. If an implant's placed in the bone in between those two teeth, then you're not touching the teeth on either side. You can, I tell my patients it's kind of like it's the closest thing that we have to putting a tooth back in your head. If you're not touching the teeth on either side. So the bone is preserved when you place an implant, and so that can help with an awful lot of things. Sorry.
That's okay. I'll ask you another question, okay? Let's see. Why is it important to operate in I'm sorry, I didn't mean to ask that question. Let me ask, why is it important to operate on live patients?
It's actually, I think, phenomenal to be able to operate on live patients. Any other course that I've gone to, of course, is lecture. You might have some hands-on, where you play with instruments on blocks of wood, or you place implants in that. But this is just, it's incredible to be able to operate on a live patient in a course. There's absolutely nothing that can compare to it.
Okay. How is it beneficial to learn on the live patients under the guidance of experts like Dr. McCracken and Dr. Rosensteel?
These two guys are just the most wonderful people that you're ever going to meet. They are so supportive and so encouraging, and never, ever, ever get annoyed because you ask too many questions. They have a very high energy, but they're down to earth at the same time. I can't say enough about these two men. I'm so thankful and blessed that we found this course. I think it was, heaven sent in a way. It's everybody here is just so wonderful, and there's I can't say anything bad about it. It's so great to be here.
Excellent, excellent. What benefits do you foresee by having the CERP under your belt and taking this program?
Again, there's nothing that really can compare to it. To be able to come here and see so many different types of different clinical situations, to be able to not only do your own surgeries but assist with other surgeries, or or see them happening. To be able to, we go through case presentations so that we get the knowledge of seeing all these other cases that other people have done, and so it's multiplied the amount of experience that you get. In a way, you sort of you can sort of when I'm assisting with another doctor, I feel like I'm doing the surgery myself. I'm sort of living vicariously through that other surgery, and I'm learning, watching what that doctor does, and or watching what they did before. We see slideshows of what we did before and after, so that's it's amazingly helpful.
Did you place dental implants before attending CERP?
Never.
Never. How has your practice changed since you've started placing dental implants?
I have a partner who found this course, and he took it first, and then I'm taking it now. and our practice has grown a lot because of it. We have the ability to offer this to patients. Unfortunately, when you refer a patient out to an oral surgeon, oftentimes to have implants placed, they're placing the implant where the bone is, and then it's difficult to restore. You know, you really have to come at it from a restorative standpoint first. And one of the big things that we've learned here is to be able to grow the bone to place the implant where the implant needs to go rather than where the bone is, and that's really important.
Excellent. How is CERT different from other dental implant courses?
The hands-on, you know, working on real patients is of course a big one. Also, I think the encouragement of the doctors who are teaching the course, their confidence in us that we can do it, and they push us a little bit, which is good. I'm one of those people that needs to be pushed. I was, you know, I described myself as terrified on my first day here, which I was, and they hold your hand as much as they need to, but as you need them to, but they still push you to, and they push just the right amount, you know, to go a little bit out of your comfort zone, you know, to do something that you would be too afraid to do on your own with nobody helping you. So there's such a support here that no matter, you know, throughout the surgery, it's constantly, you know, you can ask, hey, come look at this, what do you think? And you get encouragement or instruction or whatever, and you don't feel like you're left alone. There's no fear because there's somebody always there to make sure you're doing okay, you know. So.
Excellent. Can you tell us about the clinic and the staff?
Yeah, the staff are great. They're all very polite, and you know, they have good skills. They do a great job assisting. The front desk staff is great. Even the residents help us out so much too. You know, they're walking around. You know, we can help. They help us. You know, I asked mine today, hey, what do you think about this? You know, and, yeah, that looks good. I think they do a great job.
Thank you. Thank you so much.
Mm-hmm. That's a hard thing to do. The first question always is the toughest.
Wait, how do I? It's still recording. Hold on. Oh, there it is. Okay.